welcome to my podcast. Today I'm going to talk about another station that comes in Lab 2 examination. So basically, after you introduce yourself, as always you agreed, double check the patient name, date of birth. So it's basically a lady who escorted her child to the GP practice and she has some concerns. So you might ask her, how can I help you, or what brought you to the practice today? So the lady might say that I'm due for my MMR for my child. However, I'm having certain concern. So you will ask her, can you tell me more? What's this concern about? Is there anything that you worried about? Can you discuss this with me in order just to rule out and explore the thing around the issue? So the lady say that I hear that this vaccine might cause problem for my child, or might say that I hear that there's a link between it and autism, or I have read an article or a story or heard something from other people that I know. So this kind of things you will need to explain. So you will say, I can see your concern quite clearly, and I'm not surprised that you just prove that you are a very caring mother to her child, and just want to rule out, make sure that everything should be okay. So you'll explain that there isn't any evidence to support this link. However, MMR is quite safe and effective, and it's usually it's not a single vaccine. It's included with mumps and rubella. So basically, it will cover 3 main virus infection, and it's just in a single shot, which basically to be given in 2 doses. And you will tell her the first dose should be between 12 to 13 months. However, the second one at the age of 3 and 4 months and 5. So you need to explain that it's essential to take this because those viruses, they are quite infectious and can cause complication if the baby or the child did not take it. However, there has been certain outbreak in certain places in the UK because nowadays parents tend to not vaccinate their child, and this might cause an issue, especially with the travel. And there has been a report in certain years that there is a rise of a number of cases of measles, and this, of course, could cause issue. And the recent report from the recent data showed that there's a cluster of measles cases has been increased and found in regions outside the West Midlands where outbreak has occurred, according to the UK Health Security Agency. And this is due to the low uptake for the MMR in certain area like Birmingham, for instance. And the latest data since October last year showed that there is like 521 cases in the last 4 weeks since the new year, since 15 January. There has been other confirmed cases, which is about 166, and mostly there has been clustered like 12% around London, 10% around the northwest, 10% in Yorkshire and Humberside, and 9% in the East Midlands. So the majority of the cases for the 66% of children were less than 10. However, the other 25% were seen in young people and adult over 15 years. And this is basically those who refuse to take the MMR, so they are basically unprotected and might remain at the risk of serious complication or a lifelong disability So I need to explain to the mother or to the parent the essential or the importance of taking MMR to protect their child. And you can say that, for instance, there are certain other diseases which has been before declined or reduced. However, now it seems that they are increasing. Say, for instance, like tuberculosis. Investigation showed that there is a rise in the TB cases in the UK by 100%, by 11%. So this is another issue to be looked into because BCG offer protection against the bacteria of the tuberculosis. So you just need to rule out why patient or what the parent, they don't want to give vaccination to their child. And if there is anything that you need to rule out, explain to them in order to put them at ease. Say, for instance, for the measles, you could explain that it might cause like any other, like for instance, the flu, around the pandemic. The injection itself will cause some sort of soreness, fever, might loss of appetite. However, it will be just for a few days, and then the child or the injection site will subside, and child will be okay. And it's important because it protects against certain complications that might happen with measles or other viruses if it happens. You will just need to rule out if there is any contraindication for this vaccine because it's a live vaccine, a live attenuated. So the contraindication, those kind of cases, is mostly, as we all know, immunocompromised patient who are taking immunosuppressant medications, say for instance steroid, long-term, or radiotherapy, chemotherapy, or if there is cancer patient. So that's one of the main contraindication because their immune system is not working as it should be and can't be protective in that kind of condition. Also, if there is any previous infection, for instance, or any long-term condition, you just need to inquire, if the patient is asthmatic or have hay fever or rhinitis. Some people, they might think this is that they might not be eligible to take the vaccine. However, you can say no, has nothing to do with that. They can still take it. And also certain other conditions like epilepsy is not contraindicated. Only the immunosuppressant or immunocompromised patient who are really not indicated to take the MMR because it's a live attenuated vaccine. So you just need to explain to the patient, put them at ease in order for them to feel that it's fine to take their child to take the vaccine, and also inquire about the birth of the child, if the child is up to date with their jabs, and if their milestone is okay, and if the lady is happy with the red book. Also, if the child is feeling okay, if they have problem at all that they need to raise up while they are with the GP, just to make sure that there isn't any issue. The same thing apply for instance, flu vaccine. You just need to inquire if there is any condition or any medical condition that you need to know about. For instance, if there is fever or seizure or any of that. Apart from that, you would say it will be protective against certain virus in the winter time, and it's indicated, for instance, in certain situation as well. So you just need to inquire what's that thing that the patient or the mother might have in mind, and just rule out the issue around it. Ask if there is any medical history that you should know about, if the child or the patient taking any medication in the long run, if they have a recent upper respiratory tract infection, if there is any family history of a disease that runs in the family, or if there is any allergy, for instance. Also, you need to know if the mother has anything in mind that you need to explore with in great detail in order for the mother to take her child for the scheduled vaccination in the Red Book. I hope with that I covered the main issue around the MMR and the raising concern in the UK in order for them to go and take their vaccination as should be, to protect against the risk of any serious complication that might happen or lifelong disability. Thank you.